Next, Health and Community Services, Rhonda Powell.
Here I am.
For Health and Community Services, there were no new labor positions in the recommended budget. Expenses were up 3% from the 2017 amended, and that total was $306,038. That's just from regularly scheduled labor increases in salaries and fringes. And the Office of Senior Services is in your packets for this item. It's had no activity within the general fund since 2015. The fund was transferred to MCA beginning in 2016, so I wanted to make sure I went over that. And it's also recommended that, of course, with Health and Community Services being such a small department, that we combine this with MCA, if that's okay with you.
All right. Yes, it is.
I'll recall that. We don't want to do that.
Okay. Well, I figured there was...
Rhonda would like to present those separately. So that's all I have for Health and Community Services, and with that, I'll introduce Rhonda.
Very good. Don't go anywhere. Good afternoon, Rhonda.
Good afternoon. Thank you all for allowing me to speak just briefly on the Health and Community Services budgets, and happy Eclipse Day to everyone. So I'd like to just give a little bit on two things, just provide an overview about Health and Community Services, and then speak specifically. I'm wearing my dual hat of MCA director still for a couple more weeks, but just like to give an overview. So overall, the Health and Community Services agencies are requesting for 2018 a general fund increase of about $546,000, or about a 2.7% increase over the current year funding. What is not outlined in the numbers before you is the growing need for services to target populations in our county, such as homebound seniors, the education and health of infants and children, as well as individuals suffering from drug abuse, which we now refer to as the opioid epidemic. Each of these areas will have ripple effects on our capacity to deliver services in an effective and timely fashion for years to come. Some of that ripple effect you'll hear more about in the budget presentation for the health department and from the medical examiner's office. So we certainly appreciate your continued commitment to all of our work. Let's see, in 2018, our overarching priorities reflected in each of the budget submissions are consistent with the following Health and Community Services goals: capacity building to address targeted populations and growing needs, continued integration and co-locating of services and family resource centers, continued training and education of staff on equity and inclusion in support of One Macomb initiatives. Agency directors are here today to speak to the Health Department and MSU Extension budgets. And I also have Gary Cutler here, my wingman, in case there are any specific questions we can answer from Community Action. So as Steve Adair said, the Health and Community Services budget, there's no frills there. We pretty much accepted the budget as recommended by Finance. And so I'd like to speak for a minute to Macomb Community Action's budget. The requested changes include additional funding for senior nutrition and to cover county indirect costs. So the senior nutrition reflects about a $50,000 increase, and the indirect cost about $200,000. The agency will continue through the priorities outlined in the 2016 strategic plan, working to embed programs in the community and establish stronger collaborations across the county and across the region. So if there's questions I can answer about Health and Community Services or Community Action.
All right, thank you very much.
Absolutely.
Do we have a motion to receive and file, first of all, for the Health and Community Services? We have by Kraft, support by Sauger. Commissioner Drollet.
Thank you, Mr. Chair, and thank you for your presentation. What is it, the two areas that you pointed out that had more substantial increased funding, the senior nutrition program, for example? Can you tell me a little bit about why that additional funds are being requested? What's changed and where it would go?
Well, Macomb County is an aging county, which is pretty standard with the region. We are unique in that Macomb County delivers the Meals on Wheels program, and most of the senior programming that we offer is countywide. So we're the largest provider of a single program that services a whole county in the state of Michigan. Given the number of seniors that continue to grow in the county, it continues to and will continue for the foreseeable future to trend upward, and that need will continue to be stressed. So that's part of what's baked into our strategic plan at Macomb Community Action, is ways to look at ways to partner and deliver service and continue to make what we do more efficient.
Okay, under the current Meals on Wheels program, are there circumstances where somebody requests to be serviced by the program and we don't have the resources for that person? Are they turned down?
We actually are just starting a wait list for the program, which we have not had to do. Over the past few years, we've really made strides in just trying to make our delivery of services much more efficient. And, there used to be a 2-week wait time, or up to 6 weeks at one point, to have seniors signed up for the Meals on Wheels program. We now do that within 48 hours, 24 more often than not.
Okay.
So there's efficiencies that we're pulling out of it, but it's just the demand is outpacing that.
Okay, and is that the increased amount a sizable increase, or is it a 10% increase roughly, or just
I'm sorry, which
ballparking
increase?
the increased amount for the Meals for Wheels? What does that increase represent in terms of the program? Is it a modest increase, a substantial increase?
It's very modest in comparison to the need. The request is modest in comparison to the need.
Okay, I mean, is it like a 10% increase-ish? 20%?
Gary, I try to do the words, he does the numbers. We
I
keep our
understand.
relationship balanced.
You never know
in that way.
what questions will get thrown out there, but I'm just trying to figure out the scope of the increase for this particular program.
Well, I can tell you as far as the numbers, to keep pace with the increase, it would be probably about $150,000. But our request was for 50.
Okay, and but you don't think that 50,000 will cover the need?
It will not.
Okay, what kind of a wait list do you think will continue to experience as a result?
This is something new for us, so it's kind of hard to say. We really haven't had to maintain a wait list, and we're also working with Area Agency on Aging 1B to look at other funding and other things to try to minimize what that will look like. So we don't really. It would be hard for me to give you an estimate because this is something new for us.
I understand. So, Gary, were you able to find out what the program we spent last year and what the $50,000 represents, increase-wise?
Our senior nutrition programs between Meals on Wheels and congregate dining is just over $4 million. So this is effectively a 1.25% increase from county funds to those programs.
Okay, so it's very, very modest. Okay, that helps me put that in context. Thank you very much.
Thank you, Commissioner. Next, Commissioner Kleinfeld.
I'm still there. It just isn't showing up, so.
You disappeared for a minute.
Sorry about that. Thank you, Chair. Okay, so the total position count in Macomb Community Action appears to be remaining the same, 224.99 to 224.74, very close. But the dollar amount changes pretty significantly. So on the full-time wages, From the amended 217 to the proposed 218, it goes up by about 600,000, and then the part-time wages go up about 300,000. Is that because of the nature of the positions? Because you're dropping 6 positions under specialized services for veterans, but you're picking up 5 positions under general community programming? Is it the change in the nature of the positions that the cost is different for one position than the other?
You want to talk about the county's increase?
First of all, in our budget, between the fiscal years and the calendar years, we're adding 3/4 of an employee, 1 part-time person at our warehouse. One of our funding sources for the last 2 years has given us over $50,000 greater funds than they did back in 2014. One year we used it to buy a delivery truck, and the second year we used it to incorporate a freezer unit over there. So now we're adding that position. Now we've had funding for a few consecutive years of additional funding. We've added that position. So position control change is 3/4 of a part-time employee.
And I see the 3/4 change. I'm looking at the actual expenditures on full-time wages, 2 pages before that, and it changes significantly from 217 to 218. And if there's 3/4 of a position, I'm trying to figure out the significance of that change, as well as the part-time one.
So our full-time budget is built on being fully staffed at our staffing levels, and having the number of employees that we have and the turnover that we have. We will not most likely spend our budget, and in the current year, what you're looking at is the amended budget has budget transfers from salaries and fringes that would have went down into operations as programs went on. But the full-time wages is based upon the staffing. We have had over the course of this year, we've had some programs change. For example, our Head Start program, we have expanded up by 3 additional classrooms and added 3 staff. So they came in 2017, but you only see they came on board basically when we came back for the school year. We have training this month, and then
Have we done that amendment yet?
yes, you guys had the amendment.
Okay, so the reason I'm going by the amended budget and not the actual in 2017 is, so that amended budget is the assumption of all of the changes we've made throughout the year. Whether you're fully staffed or not and people are coming and going, what's in the budget is the full expected amount if you were staffed. So there's a $600,000 change, but your position count doesn't change at all. Your position count changes by 3/4 of a person. I don't think there's a 3/4 of a person that we pay $600,000. So I'm trying to understand, because it went up to 5.6 and the actual in 2016 is 4.9. So there's still a significant change. That amended, if you're right, when we picked up extra positions, shouldn't that amended number in 2017 be close to the amended, the recommended in 2018? Am I missing something? Or is it the nature of the positions? So for instance, you're dropping 6 under specialized services for veterans. Are those 6 employees less expensive than the 6 that you're picking up under general community programming, or the 5 that you're picking up? Are the positions higher paying positions? Is that why there's a discrepancy?
There is somewhat higher paying, but I think we need to back up. Let's look at this Head Start program. The Head Start program that came in front of you and you guys approved, those people, even though they're a body, they're only in the program here for a month. My 6 full-day classrooms will be operating the full year
For the
next
year.
but I only have 1 month of them in this current budget.
Okay.
When we had.
You didn't do for a whole year because it was halfway through the year. I got it.
So there's 6 full-time positions there, and that is also has teacher aides in the same position, where we've had them for 1 month, where next year
Okay.
they're going to be at 12 months.
I got it. It makes sense now. Some departments will ask for a full year and we'll catch on to it and say, wait a minute, we're halfway through the year. Why are you asking for a full year? So thank you. I appreciate that. Thank you, Chair.
Thank you. Commissioner Lucido.
Hi, Rhonda. Thank you for your presentation. I guess my question was similar to yours. I was looking at the page, well, on paper it's 67, where it had the minimum and the maximum salary range for 2017. And there's a jump up of what looks like, 13,000, 10,000, 20,000, 16,000, a difference in those ranges. Is the minimum what was being paid and the maximum what is now being paid, or? I mean, that's a big range.
Yes, yeah, the min-max is based off the steps that each employee has according to their position control number. The minimum is theoretically the lowest that individual would get paid. The maximum would be the highest level of pay that individual would receive.
Okay, so there's the actual numbers aren't in here.
That's
a
correct.
big difference.
It's a big range, and the actuals aren't in there because that would vary by employee on how many years they've been in the organization.
Okay, but the actual number they're being paid is in here. Is that the number Veronica was?
The
2 pages, like 4 pages.
Right.
Yeah, right.
Where it's 4 million, that number.
That's a sum of not just the wages, but also the fringes. But yes,
Okay.
that's where the actual is being done in a spreadsheet that's not included in the document. The min-max is just the range that an individual will be getting for their actual gross salary.
Okay, that's a big range. Okay. Are they,
The fringes are separate.
and is
they're
it,
not-
so it's more dependent on how long they've been there, their experience and so forth?
Yeah.
Are we more on the high end or more on the low end? Do we have new hires recently, or is it more people with experience?
I wouldn't want to speculate on that here for
that's a-
sure. We'd have to run a report
Okay.
to see how many people are at the maximum scale versus how many people are still going up the scale.
It really varies on the position, and I'm sure, Gary, but some of the higher level positions, we tend to bring in
Sure.
higher because just the Macomb County pays our pay range, Hopefully the class and comp study will help us with that to make kind of right
Right.
size, but
Okay.
it really varies on which position.
Okay, thank you.
You can't make a decision like that. Any other comments or questions? Seeing and hearing none, we have a motion and support to approve or receive and file the Health and Community Services report. Or approved.
No, I said you almost got it approved.
Yeah, I almost got it approved. Receive and file. And next, Macomb Community Action. We kind of ran them both together.
Yep, that's all I have.
Do we have a motion and support for Macomb Community Action? We have a motion by Lucido, support by Drollet. Any other comments or questions on that portion? Commissioner Smith?
Thank you. Rhonda, I don't have any other questions necessarily, but, and thank you for your presentation, but obviously you're the first one here. We haven't had the budget actually formally presented to us. Our staff who actually kind of helps us with the whole budget is going to be starting Wednesday with us. So I just want to let you know, probably to expect
Okay.
quite a few more questions as we get a little
Yes.
better chance, because this was all just given to us recently.
We're
very
here all
recently.
week.
Right, yeah. Well, hopefully longer than that. But, and everybody else, I just wanted to mention that Sam will be starting with us this week, and it'll, kind of give us a little better insight into, some questions that we may want to be asking, or maybe everything's just fine. But I just wanted to let you know to
Okay.
probably expect a few more questions. Thanks.
Okay, will do.
Rhonda, well done,
Thank you.
and welcome aboard
Thank you.
in a new position. We have emotional support. Then vote. All in favor, please vote. I believe it passed. 10-0 passed. Thank you.